Imagine turning agricultural waste into life-saving chronic wound care. That's exactly what VulGenix does. The challenge with current wound dressings is their static design, which fails to adapt to the evolving needs of wound healing. The synthetic composition also requires proper waste treatment, where improper disposal leads to toxic medical waste. Our solution is a bacterial cellulose hydrogel dressing that adapts to wound needs, is biodegradable, and is produced from agricultural and food processing waste. First, we source food waste from farmers and food processors and convert it into a carbon-rich growth medium. Next, we introduce a culture of K. xylanus, which consumes the growth medium and produces a pure, residue-free cellulose pellicle. After boiling and purification, this material becomes bacterial cellulose or BC hydrogel. Finally, we infuse varying therapeutic agents into the BC hydrogel and mold it into chronic wound dressings. Current chronic wound dressings are costly and designed for months of use. By using organic materials, we offer affordable, short term dressings where frequent replacement becomes our strength, allowing each one to be formulated to evolving wound needs. For example, for moisture balance and exudate control in early stages, we can formulate hyaluronic composites. For intermediate care, we can add biocarriers like vitamin A and C solutions to stimulate tissue granulation and angiogenesis. For end stage care, we can composite collagen stimulators for minimal scarring and better recovery. The benefits of these progressive formulations aren't present in current static hydrogels. Our product makes sustainability a built in function, not an afterthought. With 1.3 billion tons of food waste driving 8 to 10% of global emissions, and medical waste leaching toxins into ecosystems, our solution reduces environmental harm on both ends. Our project supports the United Nations SDG 3 with affordable, adaptable wound care, SDG 9 by making production and disposable simple, requiring minimal infrastructure, SDG 10 by improving access to care for underserved communities, SDG 12 by turning food waste into medical dressings, and SDG 15 by reducing long term medical waste that harms life on land. Our next steps to scaling include university level lab testing for consistent quality, IRB approved in vitro and in vivo testing with biomedical labs, initiating patent filing to protect IP and attract investors, procuring FDA approval, and leveraging sustainability grants, tax incentives, and medical manufacturing partnerships to industrialize. Altogether, vote for a solution that does not just treat wounds, but builds a better future. Thank you for listening.